Hello and welcome to this video on the use of dolls in dementia care. This video will explain how dolls can be used to help meet the needs of people living with dementia. It will also explain some of the barriers of using dolls with people with dementia and how we can overcome these by following guidelines on the use of dolls. Dolls have been used for over a decade in dementia care and were initially used as a complementary therapy to promote feelings of well-being in people living with dementia who were agitated, had communication difficulties, or were withdrawn. Over time, several benefits have been found with the use of dolls in dementia care. They can be used as a reminiscence aid, as a way to activate the senses, and can help to improve speech and communication. A doll can help to provide a focus of conversation between care staff and residents. Dolls can also provide comfort, reduce restlessness, and can appeal to an individual's sense of nurturing by providing something to care for. Dolls have also been found to help aid eating and drinking in people with dementia, as they have the doll for company. Improved sleep quality and increased compliance with assistance with personal care have also been noted to be benefits with the use of dolls. As a result of these benefits, they have also been found to reduce the use of antipsychotic medication, which are often used in dementia care to reduce agitation and hostility. We believe dolls work as they help to meet the fundamental needs of people living with dementia. Fraser and James identified many of the needs that were being met for care home residents by the use of dolls. These needs were the need for attachment, comfort, activity, memories, innate drives, fantasy, communication and interaction, inclusion, identity, and role. Let's now take a look at each of these in turn. Firstly, starting with attachment. Attachment has long been identified as a key psychological need for people living with dementia. This is due to new challenges, anxiety, and uncertainties that are faced as a result of the advancing disease. We see people living with dementia express attachment needs when they are calling out for a parent or searching for their mother or father when they are in an unknown environment where they maybe don't feel safe. When residents move into care, they may experience a sense of loss. This could be in relation to their family members or their familiar belongings, which usually surround them in their home environment. A doll can help meet this need for attachment. A doll can also meet the need for comfort through activating the senses and by gaining companionship with a figure that is constant and can help overcome loneliness. A doll can also bring purpose to a resident's day-to-day life. For example, caretaking activities such as nursing, feeding, putting the doll to bed, singing to the doll, and acting out past roles, which all help to meet the need for activity and occupation. A doll can also create a sense of inclusion. For example, a group like a playgroup or parent and baby group can be formed with all residents engaging in an activity with the doll. They can also provide a basis for conversation and interaction between the person living with dementia and care staff. For example, passing the doll between each other, sitting more closely to each other, and better eye contact. Dolls can also help meet the need of a sense of identity and role by cueing past memories of being a parent and talking about their own children, and sharing stories as well as educating others about their life history and their children or younger siblings. Dolls also tap into natural inner drives to care and engage in social contact, even if they never had children. A doll also allows the opportunity to engage in fantasy, whereby the person living with dementia can play out roles or revert back to earlier times in their lives of being a parent. Dolls also help to evoke memories. These may not necessarily be cognitive, but may include memories of movement, such as rocking a baby to sleep, or emotions. Dolls, like any intervention, aren't without issues or unwanted side effects. Family members or carers may be concerned that dolls infantilize people living with dementia, as dolls are normally associated with young children and may be seen as demeaning or patronizing. There are also concerns regarding deception if the person with dementia believes the doll is a baby and we need to enter their reality and go along with this, which may make people feel uncomfortable as they feel they are lying to someone with dementia. The person living with dementia may become possessive over the doll and may prioritize the doll's needs over their own. For example, feeding the doll over lunchtime, so not eating or sleeping themselves. Dolls can also elicit negative memories, so it's important we know the personal history of an individual before introducing a doll. For example, No one is taking this baby away from me. Dolls that breathe or cry can also result in issues too if they stop breathing or crying. So what can we do to overcome some of these issues? If the person living with dementia cannot consent, we should seek family views and consent before a doll is introduced to their loved one. By simply placing dolls around the unit, this will help with consent, as the person living with dementia can decide if they wish to pick up the doll rather than having it forced on them. Although this is an issue if family have not consented first and their loved one has already picked up a doll. An information sheet in the unit's welcome pack and posters on the unit can help make families aware that dolls are used on the unit. There are guidelines for the use of dolls which can help minimise possible distress. These guidelines advise that staff should refer to the doll by the same name used by the resident. A doll should never be taken away without the resident's permission, and when removing the doll, a valid reason should be given, such as, "I'll take the baby to the kitchen to feed him so you can eat your dinner in peace." This should include a description of where the doll is being taken and when you will bring it back. The use of dolls should also be in the person's care plan and monitored for issues such as fatigue. If the resident wants to take the doll to bed, this is okay, but you may need to provide a cot or makeshift bed if they are not sleeping in their bed due to the doll being there. A doll should never be removed as a punishment or to get someone to do something such as personal care. The doll should not be relied on as a source of activity. Residents should still be encouraged to engage in previously enjoyed activity. The doll should be used to promote joint activity between staff and residents, such as jointly washing or feeding the doll, not as a pacifier. In summary, the use of dolls can help to meet a variety of needs for people living with dementia. The use of dolls should be targeted towards each resident's needs, preferably based on a formulation and knowledge of the person's life history and preferences. Doll use should be included in a care plan and guidelines for doll use followed. We hope you found this video helpful. Thank you for listening.